Non-communicable diseases. In this video, we will look at the introduction to non-communicable diseases, risk factors associated with non-communicable diseases, coronary heart disease, CHD, prevention and treatment for cardiovascular diseases. Non-communicable diseases, NCDs, are not transmissible directly from one person to another. Instead, they emerge over time due to genetic, lifestyle, and other environmental factors. Some common examples are cardiovascular diseases, cancer, chronic respiratory diseases like asthma and diabetes. Non-communicable diseases, NCDs, do not result from infections caused by pathogens like bacteria, viruses, parasites, or fungi. Risk factors associated with non-communicable diseases. A risk factor is any attribute, characteristic, behavior, or exposure that can contribute to anyone developing a disease or health condition. These factors can be biological, environmental, behavioral, or social. A risk factor is any substance or lifestyle aspect that increases the likelihood of developing a disease. Some risk factors cause specific diseases. The significant risk factors associated with a person's well-being are poor diet to obesity, smoking, lack of exercise, alcohol, and carcinogens. Now, let's look at some of the risk factors and diseases associated with them. Obesity and lack of exercise. Obesity and lack of exercise can cause diseases related to type 2 diabetes and heart disease. Type 2 diabetes. The body doesn't produce enough insulin, making it difficult to control blood glucose levels. Cardiovascular diseases. High cholesterol levels in the blood can increase the risk of CHD, coronary heart disease. Alcohol. Continuous high levels of alcohol consumption can lead to various health problems. Liver cirrhosis. This condition progresses over time. It involves the gradual replacement of healthy liver cells with scar tissue. Brain. Alcohol initially reduces anxiety and inhibition, but later causes negative emotions such as anger, depression, and anxiety regardless of mood. Unborn babies. The consumption of alcohol during pregnancy can lead to severe risks, including miscarriages, premature births, and congenital disabilities, as alcohol can cross the placenta. Smoking. Smoking is associated with a multitude of health risks. Cancer and other major risk factors. Smoking raises the risk of over 50 severe health issues, such as lung cancer, coronary heart disease, heart attack, stroke, and more. Unborn babies. Smoking can cause premature births and birth defects, as the chemicals can pass through the placenta. Carcinogens. Some common risk factors associated with carcinogens are cancers. A substance that can induce cancer in living tissue is a carcinogen. It could be a substance in the air, a product you use, or a chemical in food or drinks. Tar is a sticky brown substance that discolors the teeth and fingers of smokers. It contains carcinogens, which are cancer-causing particles. Exposure to UV light from the sun can cause mutations in DNA, which, if left uncorrected, can lead to uncontrolled cell division, resulting in cancer. Some of the most common carcinogens are alcohol, tobacco, processed meats, UV rays, and asbestos. Coronary heart disease, CHD. Coronary arteries supply blood to the heart muscle. The cause of coronary heart disease varies depending on the type. For instance, the buildup of cholesterol, a waxy substance, in coronary arteries can cause plaque and lead to coronary artery disease. It reduces blood flow, leading to less oxygen for the heart and possible heart attacks. Coronary heart disease is a significant contributor to mortality rates in the United Kingdom and across the globe. It can also affect the structure of a baby's heart and is estimated to occur in 8 to 9 out of every 1,000 births. Coronary heart disease is also called ischemic heart disease. Prevention and treatment for cardiovascular diseases. Cardiovascular disease, CVD, affects the heart or blood vessels. A low-fat diet can prevent cholesterol buildup and reduce the risk of blocked arteries and cardiovascular disease. Stent. A stent is a small wire mesh tube inserted into a blocked or narrowed coronary artery to support it and keep it open. The pros of stent are: it opens narrow passages in the body, such as arteries, and increases the oxygen supply to the heart. It is not a major surgery. The cons of stent are: it can damage blood vessels, can cause blood clots, can lead to infections. Statins. Statins are prescription drugs that lower cholesterol levels and slow plaque buildup in arteries. Pros of statins are: no surgery is needed. Helps to prevent CHD. Cons of statins are: can cause side effects such as muscle pain, headache and sickness. Cannot cure CHD. Transplants. Transplantation involves moving cells, tissues, or organs from one location to another, either within the same person, autograft, or between different individuals, allograft or xenograft. For example, a heart transplant involves replacing a failing heart with a healthier donor heart. Pros of transplants include: a heart transplant can improve the length and quality of life for eligible candidates. It can be used as a last resort for individuals experiencing end-stage heart failure. Cons of transplants include: organ transplants require careful matching between the donor and recipient to minimize the risk of rejection. It is a major surgery that might cause blood clots, blood loss, infection, and damage to blood vessels. Valve replacements. Replace faulty heart valves with mechanical or biological valves. Mechanical heart valves are expected to last more than 20 to 30 years, while biological ones may only last for 10 to 15 years. Pros of valve replacements: controls blood flow through the heart. Provides long-term cure for faulty valves. Cons of valve replacements: can damage blood vessels, can cause blood clots, can lead to infections. Artificial hearts are commonly used as a temporary measure until a heart transplant can be performed, or as a permanent solution when a transplant is not feasible. Cancer. Cancer is a disease in which abnormal cells divide uncontrollably and destroy body tissue. It can originate in virtually any organ or tissue in the body. When cells start to divide abnormally and quickly, it can lead to the formation of a tumor. There are two main types of tumors. Benign tumors are non-cancerous, as they don't spread in the body. Malignant tumors are cancerous and can metastasize, spreading to other body parts and causing new instances of the same cancer. Metastasis occurs when cancer spreads to a different body part from where it originated. Prevention and treatment. Researchers believe that many factors that could potentially influence the development of cancer result from lifestyle and personal choices. Making significant lifestyle changes can help prevent cancer. The three main treatments for cancer are: chemotherapy. Powerful chemicals or drugs are used to kill cancerous cells. Radiation therapy. X-rays are used to kill cancerous cells. Surgery. The medical procedure in which the tissues with cancer cells are removed from the body. Mental and physical health. Being healthy involves physical and mental well-being. Our mental health encompasses our emotional, psychological, and social well-being. The factors that affect health are: diseases, communicable and non-communicable; stress, diet, exercise, life situations. The interaction of various diseases can impact our health. A weaker immune system increases susceptibility to infectious diseases compared to a stronger one. Some viruses, like HPV, can cause cervical cancer. Hepatitis C can also cause liver cancer and non-Hodgkin's lymphoma. Severe physical ill health can lead to depression and other mental illnesses. Pathogens can cause immune reactions that lead to allergies, such as skin rashes and asthma.